This medicine helps to treat specific severe bacterial infections like pneumonia, urinary tract, or intra-abdominal infections. It's a type of antibiotic called carbapenem, and it works by preventing the bacteria from growing. It's important to take this medication as directed by your healthcare provider, and be sure to take the full course of the medication even if you start to feel better. The usual dosage is 1.25 grams, given intravenously. It's typically administered by a healthcare professional in a hospital or clinic setting. The best time to take this medication is as directed by your healthcare provider. This medication is administered through an injection into a vein, usually every 6 hours as directed by your doctor. The dosage will be determined based on your medical condition and how you respond to the treatment. If you are using this medication at home, it's important to learn all the preparation and usage instructions from your healthcare professional. Before using it, make sure to visually inspect the product for any particles or discoloration. If you notice either of these, do not use the liquid. It's also crucial to learn how to store and dispose of medical supplies safely. To get the best results, it's recommended to use this antibiotic at evenly spaced times. To help you remember, use it at the same times every day. It's important to continue using this medication until the full prescribed treatment period is finished, even if your symptoms disappear after a few days. Stopping the medication too early may cause the infection to return. Be sure to inform your doctor if your condition doesn't improve or gets worse. Some side effects of Recarbrio 1.25 gram intravenous solution antibiotics with anaerobic coverage may include swelling, redness, or pain at the injection site, as well as nausea, vomiting, diarrhea, or headache. If any of these effects persist or worsen, notify your doctor or pharmacist. This medication has been prescribed because your doctor has determined that the benefits outweigh the risks. Many people using this medication do not experience serious side effects. Seek immediate medical attention if you experience any serious side effects, such as changes in mental/mood, dark urine, yellowing of the eyes/skin, new signs of infection, unusual tiredness, fast heartbeat, or seizures. Recarbrio may rarely cause a severe intestinal condition due to a bacteria called C. difficile. Contact your doctor right away if you develop persistent diarrhea, abdominal pain/cramping, or blood/mucus in your stool. It may sometimes cause oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. Although very rare, seek immediate medical help if you experience symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed, contact your doctor or pharmacist. If you have any concerns about the side effects, it's always best to consult with your healthcare provider. Before using Recarbrio, make sure to inform your doctor or pharmacist if you are allergic to imipenem, cilastatin, relebactam, other carbapenems, penicillins, or cephalosporins. Also, let them know about any other allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Before using this medication, it's crucial to inform your doctor or pharmacist about your medical history, especially if you have a history of brain disorders, kidney disease, or stomach/intestinal diseases. It's important to note that this medication may cause live bacterial vaccines, such as the typhoid vaccine, to not work well. Make sure to inform your healthcare professional that you are using this medication before getting any immunizations or vaccinations. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor before using this medication. It's also important to note that imipenem and cilastatin can pass into breast milk, while it is unknown if relebactam passes into breast milk. Make sure to consult your doctor before breastfeeding if you are using this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This is not a complete list of all possible drug interactions, so it's crucial to keep track of all the products you use and share this information with your doctor and pharmacist. It's important to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Recarbrio 1.25 gram intravenous solution antibiotics with anaerobic coverage are ganciclovir, valproic acid, and related drugs such as D-valproic sodium and sodium valproate. It's also important to note that this medication may interfere with certain lab tests, such as urine glucose tests, which could potentially cause false results. It's essential to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much Recarbrio and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. Symptoms of overdose may include seizures. It's important to take Recarbrio exactly as prescribed by your healthcare provider to avoid any potential overdose. It's important not to share this medication with others. This medication has been prescribed specifically for your current condition, so do not use it later for another infection unless directed by your doctor. Your doctor may also conduct lab and/or medical tests while you are using this medication, such as a complete blood count and kidney/liver function tests. It's important to keep all medical and lab appointments and consult your doctor for more details. Make sure to take Recarbrio 1.25 gram intravenous solution antibiotics with anaerobic coverage exactly as prescribed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. Make sure to refer to the product instructions and ask your pharmacist about how to store Recarbrio 1.25 gram intravenous solution antibiotics with anaerobic coverage. Always keep medications out of the reach of children and pets. Do not dispose of medications in the toilet or sink unless specifically told to do so. When the product is expired or no longer needed, be sure to dispose of it properly. Ask your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.